Good morning, good afternoon, good evening, everybody, depending on which part of the world you're actually tuning in from. Thank you so much for putting time aside to come on this webinar. Just to give you a little bit of a background, Dr. Erik Reis had a lecture at the UEFA Medical Symposium a few weeks back, and it was only a 15-minute lecture, but because non-thermal high-energy laser is such a huge education to everybody this side of the pond, we had so many questions. We thought the best thing to do would be to expand on that presentation to give a lot more information and a lot more, I suppose, knowledge behind each slide, because Dr. Erik was, as you can imagine, in a bit of a hurry when he had a 15-minute slot. So, anybody who doesn't know me, my name's Simon Ramshaw. I'm Managing Director of Erchonia Lasers Limited. We are a UK-based subsidiary distributing all US-based Erchonia devices in Europe, Middle East, and Africa. So as you can see, it's dark here now, whereas in the US, it will be light. So this webinar is titled Light Recovery and Genetics, Unlocking Athletic Potential with Cutting-Edge Science. And it's basically discovering how introducing the likes of non-thermal high-energy lasers into this specific presentation is about into an athletic practice. So at UEFA, we had a lot of heads of medical at various different football teams around, or soccer teams, if anybody from the US is tuning in, around Europe and the Middle East. Also the individual football federations. We also had a lot of representatives from UEFA and also FIFA as well. So it's something where we see not just your general everyday enhancement of performance in us as individuals, but if we're looking at high-end sports, it's very much to do with trying to come up with a legal edge that we can give over the competition, just to maximize as human beings what we have already inside us, where sometimes we're maybe just lacking the inspiration. So without further ado, I will introduce you to Dr. Reis, just give you a little bit of a synopsis about his experience. He's a Doctor of Chiropractic Medicine and is a Board-Certified Chiropractic Neurologist at the Neural Connection in Minneapolis. He received his Doctorate in Chiropractic Medicine from Northwestern Health Sciences University, graduating with a magna cum laude honors, and graduated from the University of Minnesota with his Bachelor of Science in degree in Kinesiology and Exercise Science. Where am I? He's utilizing clinical applications and therapeutic interventions in neurological and nutritional rehabilitation of traumatic brain injuries, concussions, and vestibular disorders through the Carrick Institute of Clinical Neuroscience. So Dr. Erik Reis comes with a huge portfolio of knowledge and expertise, both practical and theory. He's an international speaker, and as I alluded to before, was across in Lugano a few weeks ago talking to the delegates at the UEFA conference. He's been over to Dubai talking about the current state of affairs in healthcare and what we can do about it. So I'm absolutely honored to introduce to you Dr. Erik Reis. And again, thank you so much for your time and coming on and sharing your knowledge and education with the viewers.
Thanks, Simon. It's always a pleasure to be with you guys. So I know that there are a lot of people that probably have so many questions about what we're talking about with Erchonia, low-level lasers, and then how this all implicates with treatment, training, prevention, prehabilitation, and post-rehabilitation. And so I hope to elaborate more on that today and really give a pretty in-depth discussion about what can be done in a legal, effective, performance-enhancing manner to help people and our athletes update their software. So I'm going to really dive deep into this. I've got a decent amount of slides, but we're going to probably present for about 45-50 minutes, and we'll leave the last 10 minutes for questions. So Simon's going to be my gatekeeper there, and he's going to make sure that if there's any questions that come up, I want to answer them in the moment. So I think that that's more interactive. I don't want this to be a lecture. I'd much rather have it be a conversation. So we're going to do the best with what we can. So I'm going to go ahead and share my screen here. And as Simon alluded to,
Erik, I'll come off video as well. Take my video off and just point out down the right-hand side, attendees will be able to see a chat part. So if you have a question, please leave it there, and I'll alert Dr. Erik to it as quick as I can. Thank you.
Thanks, Simon. As Simon alluded to, I have a lot of extensive background and clinical experience in treating a lot of sports injuries, but especially the neurological injuries, so concussions, brain injuries. I see a lot of patients in chronic pain. And so the relevance for that is that what we're really talking about here is really trying to help our patients and our players update their software. Because we have to pose the question, like, what does healthy aging look like for a professional footballer? What does healthy aging look like for our general society, right? We still know that 1 in 3 people worldwide are suffering or going to pass away and die from cardiovascular disease, most of which can be prevented with healthy diet, healthy lifestyle, healthy habits, sleep, things like that. And so we have to kind of pose the question, like, what do we want the future for footballers to look like? Whether you're a professional footballer, whether you're semi-pro, whether you're playing in the MLS, you're playing soccer in the US, you're playing in a league worldwide, the question needs to be posed because we are in an interesting situation where we're understanding what's going on structurally, neurologically, and metabolically. And I think this question is something that we should all be wondering is, what does this healthy aging look like in general? And what I'm going to argue, and what I'm going to put some strong evidence towards, is that it all comes down to the brain, right? This beautiful, amazing organ that we all possess that weighs about 3 pounds, which is about 1.2 kilograms. And this amazing thing allows us to do the things that we attribute to humanity, which is thinking, moving, acting, singing, all of the things that we take for granted until we lose it. And for most of us, this is really what the brain looks like, right? But here's how the brain actually functions. The brain functions like a superhighway of computers, of these different nodes of, think of NVIDIA chips on steroids, spread throughout the entire brain, the entire cortex, and the entire central nervous system. This is actually how it operates. It operates in different systems and in different processes. These neural networks are really important for us, and they're especially important for individuals in the pro sports arena. Now, I don't think anyone's going to be surprised by me saying that the brain controls everything, but it genuinely does control everything. Yes, it means being able to move your feet, your hands, your legs in specific patterns, but when was the last time you considered sending enough blood flow to your gut or to your brain or getting enough oxygen to those areas? When was the last time you thought about regulating your heart rate or your blood pressure? Most of the time, most likely you haven't, and that's a really good thing. But your brain in some way, shape, or form has to tackle and control that. And so there are different systems and processes that we are aware of, and we may not always be consciously aware of, that the brain has to control. And where things get interesting is when you're dealing with injuries, trauma, head injuries, concussions, things along those lines, where the central nervous system may no longer function as well as it used to. And that's relevant for us. Now, while we may not all agree on specific aspects or specific ways to help people update their software, I think that there is probably something that we can agree on. So I pose this question for you. This is kind of my ideal treatment plan checklist. So clinically, if I could do all of these specific things with my patients and know that I'm not hurting them, but I'm going to help improve their performance and their cellular acceleration of healing, then I would be doing it, right? So if I could do something that's non-invasive, has minimal downtime, and causes no pain, of course I'm going to check that off my list. If I can always get my patients out of pain and decrease swelling and optimize blood flow, absolutely I'm going to sign up for that. We'll talk about mitochondrial function and how this is really the key central component and linchpin to longevity. Whether you're a professional footballer, you're living in your 70s or 80s, or you're a young child trying to make it in the world, the mitochondria really is the cornerstone and linchpin for longevity and aging. If I can dampen inflammation, optimize the immune function of my patients, decrease stress responses, have protections for the brain and help them regulate stress, I would sign up for every single one of these aspects. Now, the hardest part is that to get all of these different benefits, you would most likely have to do 5, 10, maybe even 15 different types of treatments. That could be structurally, could be neurologically, could be metabolically, or could be a combination of all of the above. So I want you to bookmark this because I think this is something that's really relevant and important for us. So where are we currently at today? Well, this is one of the latest studies that I could find about the UEFA club and their club injury study that they ran from 2001, 2002 to 2021, 2022. And what's interesting about that is as much as we've advanced in technology and science and our understanding about the brain and the body, we're still seeing increases in specific types of injuries. specifically hamstring injuries. These have doubled since the start of this study. And what's interesting with it is that this continues to get worse and worse. But what if we could actually prevent these injuries from happening? Now we could say, well, maybe these hamstring injuries are coming more often because we're overtraining a bit, or maybe the environment has changed, or maybe we're just placing a little bit more demand on our players in the games that they're playing. Chicken or egg kind of conversation, but what I can tell you is that the data doesn't lie. And so if we're seeing increases in injury rates, well then let's try to quantify what can actually happen or what actually does happen when a player is out with one of their injuries. So this was a really interesting analysis that was done in September of 2022. It was done by the European Football Injury Index. It essentially categorized the rate or the amount of injuries that occurred in European football players. It also calculated the injury costs. So if you look at the bottom of this chart, ankle injuries cost 16.82 million pounds per year for a total injury cost for professional European footballers. And as you go through each one of these categories, you'll see that those injuries stack up over and over and over. No, most notably, take a look at the hamstring injuries. Hamstring injuries by themselves equate to about 30.9 million pounds per year for a total injury cost. Now, when you take a look at this, that's a lot of money that's being lost. Any club, any trainer, any physio, any manager would pay half of that to prevent any of these injuries from happening with their team in the first place. And then, of course, we get into the structural injuries, but on top of that, we get into the neurological injuries, right? Even concussions cost about 1.16 million pounds per year for the local clubs and for the entire European Football Association. What if we could cut that injury rate in half? What if we could cut the recovery rates in half? What if we could cut the healing times in half as well too? Is that worth your time? Is that worth the money? Is that worth the prevention that could actually be deployed to utilize and make sure that these injuries are maybe lessened, because we won't ever fully get rid of them, but decreasing the frequency and intensity? Because here's the problem, right? As athletic footballers get into the European football clubs, Champions League, Premier Leagues, wherever league they're playing in, they're going to age inevitably in some way, shape, or form. Now, when you're 17, 16, aging to 18, 20, 22 is actually going to be a beneficial thing. But what happens as players get older? Well, we start seeing these patterns of maybe they're having increased healing times. Maybe it's taking them a little bit longer to recover. Maybe they're requiring a little bit more sleep, a little bit more downtime, a little bit more rest. The neurometabolic cascade of the body and the brain on aging is a bit complex for so many reasons. Now, at the center of all of this is going to be dysregulated energy metabolism. Well, what does that actually mean? Well, it comes down to mitochondrial function, and it comes down to making sure that whatever you can do structurally, neurologically, and metabolically, you are continuously and consistently supporting your mitochondria. Because the most mitochondrial rich organ in your entire body is your brain, and second behind that is skeletal muscle. And so if these are two of the most common areas for injury, or some of the most common areas for acute and chronic injuries, then it makes sense for us to understand what we can do to help these athletes update their software. And don't just take my word for it. There is study after study after study after study that continues to suggest and validate that your mitochondria are the foundational, fundamental linchpin components of healthy aging. Your mitochondria can be your friend, but they can also be your enemy, from a stance that if these cellular mechanisms are no longer supporting you, they could potentially even be hurting you. So why us? Like, why does this happen? Well, when I was in school, I was taught that your mitochondria only produce ATP. And yes, while they do that, they do so much more. They're involved in energy supply, they're involved in cellular signaling, they're involved in the regulation of inflammation, they're also involved in immune function. And you see this in the literature time and time again. Pro-inflammatory mediators, these different types of cytokines that promote inflammation, repeat themselves over and over and over again in the research. And we're talking about things like C-reactive protein, interleukin 6, interleukin 1 beta, and at times fibrinogen. Now you're going to see these molecules and these markers come up time and time again because they consistently play a role in chronic disease, they play a role in delaying recovery, they play a role in cognitive delays, mental health, inflammatory-based conditions, and even neurodegenerative conditions. And so we know the mitochondria are at play. Well, let's take a step back quick. We talked about this ideal treatment plan list. And so if you could even get half of these booked together in a specific unit or a device, would you sign up for that? I hope that the answer is yes. So if this is our ideal treatment plan checklist, here's what I want to tell you. Non-thermal low-level laser can accomplish every single one of these tasks in one tool and one modality. I'm going to go through and talk about a majority of these tasks, with the exception for the non-invasive fat loss, because that's not relevant for our conversation. But Erchonia has 6 FDA clearances for non-invasive fat loss and body contouring. For the athletes after their careers, or for the athletes' partners, spouses, maybe that is something that's relevant for them. But here's what I'm going to tell you is that non-thermal low-level laser immediately and sustainably and efficiently upregulates mitochondrial function. So let's get to some of the basics. What is non-thermal low-level laser? Non-thermal low-level laser is concentrated light that sends billions of photons of energy into the cell. Much like sunlight stimulates the skin to produce vitamin D, non-thermal low-level laser penetrates into cells and upregulates cellular function. In the earliest stages of this non-thermal low-level laser research, everyone was looking into red light therapy. And the main mechanism or the action was specifically upregulating an enzyme called cytochrome C oxidase. It's intimately linked with the 4th electron transport chain complex. And what this does is it upregulates the production of ATP. Well, we know that ATP production is not only important for energy sustainability and recovery, but we also know too that when you upregulate mitochondrial function, you can also dampen inflammation, accelerate healing times, and optimize immune functionality. And this is where things get really interesting with non-thermal low-level laser, is that it's not just about red light therapy. There's clinical data now showing that different types of wavelengths, which correlate to different colors, can actually benefit and upregulate all 4 of the electron chain complexes that are involved in the mitochondria. If you take a look at the photo on the right side, you can see violet blue light, which is around 405 nanometers, can actually have beneficial effects for upregulating the 1st and 2nd complex of the electron transport chain. Green light, which hovers around 422 to 430, can actually upregulate that 3rd electron transport chain complex. And of course, as I mentioned, this 4th electron chain complex is upregulated by that red light. And so as you stack these lights on top of each other, what you can actually get is you can actually get a significant increase in the production of ATP, which in turn can help accelerate recovery, performance, rehabilitation, and in some cases, you can actually potentially even prehab and prevent injuries from happening. Now, here's what we know. We know that these complexes are kind of susceptible to medications, aging, and even pharmaceutical drugs. That 1st electron chain complex is very susceptible to 2 really common medications that most of the public or patients coming into your office or room are going to be struggling with. That 1st complex is heavily influenced in a negative fashion by 2 drugs, statins and metformin. Now, statins are given for people with high cholesterol. Metformin is usually given for people with type 2 diabetes. A majority of the patients that you're seeing, if you're not a professional football trainer, coach, or athlete, most of the patients and people that are coming in are going to be on those medications. But there's also a chance that there are professional athletes that are also on those medications. And so if medications and pharmaceuticals can impair these complexes, it's going to affect recovery rates, treatment times, and the ability for somebody to actually improve as quickly as possible. What's great about these wavelengths is we know that they have different benefits. That red 635 nanometer wavelength can upregulate mitochondrial activity, as we've just discussed. We know it has benefits for cellular proliferative activity, where cells need to go and stem cells need to move to repair damaged tissue and to upregulate healing. We also see beneficial improvements and increases in the production of interleukin 10, which is a beneficial anti-inflammatory interleukin. We know that the 532 nanometer wavelength, that green wavelength that I discussed, can actually show reductions in tumor growth factor beta, which is once again a pro-inflammatory mediator. And then last but not least, this 405 nanometer wavelength can actually have a reduction in apoptotic cell processes. We also know it can have antiviral, antifungal, and antibacterial benefits and properties. So what's great about these different wavelengths, what's great about non-thermal low-level laser is not only is there clinical and research data to back it up, but we also have real-world evidence that this benefits us as well. Well, why are we sticking in this visible light spectrum? The reason why is that this visible light spectrum has far more energy than any other wavelength out there. So as you move from radio to microwave, and even a lot of infrared products out there will say, well, we have higher power, we have higher power, we have more power than these visible light spectrum wavelengths. Well, the problem is when you increase power, you actually increase the production of heat. You have a photothermal effect going on instead of a photochemical. The photochemical benefits that you see in the visible light spectrum are what actually cause the mitochondria to upregulate their production. And these electron volts are a really important aspect. In order for an electron to jump valence rings, for those of you who can go back to the organic chemistry days, these electron volts are really impactful. And 405 nanometers has about 70% more energy per photon than 830. This is one of the reasons why we're a non-thermal, low-level energy, low-level laser company, is because we don't want to produce heat. We don't want to have high power. We want to upregulate the energy and utilize proper wavelengths, which will actually upregulate cellular function and overall healing. We know that this higher power doesn't actually promote more healing. All that it does is sends out more photons into the tissue, and more photons doesn't necessarily mean more healing. Energy is only affected by the wavelength, and this biphasic dose response is something that's really important. More power actually doesn't also just increase depth of penetration, it can increase the thermal effects, meaning you're having more heat, you're producing more heat because of the oscillation and vibration of water molecules. Well, what can heat do? Can you get too much heat? Absolutely. So there's some research out there showing that when you have too much heat in a tissue, you can actually start promoting the denaturing of proteins, the denaturing of DNA, and you can actually start having necrosis of tissue when heat becomes too high. This biphasic dose response is a really interesting concept. This Arndt-Schultz curve is really important, and one of the fundamental reasons why the Erchonia has come out with these non-thermal low-level lasers is because you can actually get the optimal dose in the middle of the dose response. So as you see in the photo on the left, the fluence, the amount of influence, the amount of benefit you're going to see with different aspects of low-level laser therapy is actually somewhere between 3 to 4 joules per centimeter squared. And there's a reason why Erchonia's handhelds, their stands, their large units are in this wavelength and in this parameter, in this area of focus, because too much cannot be a good thing, but too little can also not be a good thing. And so when you're right in that Goldilocks sweet spot, what happens is you see all of the benefits and you see all of the mechanisms at hand. I'm going to make a really strong argument for why you should be using non-thermal low-level laser in your club, in the arena, on the sidelines, at home, and with your patients. It's because one, it works, but two, the downsides and the chances for you hurting somebody are slim to none, especially if you're going with Erchonia, who has 22 of the FDA clearances on the market for non-thermal low-level laser. There's a reason they do those studies, because we know that low-level laser therapy can equate to sports optimization. Both preconditioning the laser and using the laser before and after exercise can actually improve sports performance in athletes. We also know that low-level laser can actually increase muscle mass gained after training. It can decrease inflammation, it can offload the oxidative stress loads that happens. And in this study, it was really interesting. We raised the question of whether PBM should be permitted in athletic competition because it seemed to give the lasered athletes an unfair advantage. We hear this from our clients, we hear it from our patients, we hear it from our doctors. And what we know is that non-thermal low-level laser, when it acts on the mitochondrial complexes, can have a significant impact on the patient's ability to improve their recovery, their performance. Pulse low-level laser can improve delayed onset muscle soreness and voluntary muscle contraction. In this study, muscle contraction was maintained in the low-powered laser light group compared to the placebo. Well, guess what the placebo group was? Light-emitting diodes, another photobiomodulation based therapy that actually we use clinically for our double-blind placebo-controlled studies, because as much as people tout and say what it does, We know that non-thermal low-level laser actually works on a photochemical level, not a photothermal level. We also realized in this study that high-powered continuous laser did not demonstrate any positive effects on delayed onset muscle soreness or maximum voluntary contraction. It actually increased creatine kinase activity, which could suggest muscle damage. We know that the non-thermal low-level laser benefits can be used not only after performance, but during and even before performance. Using non-thermal low-level laser as a prehabilitative therapy or tool can be very effective in preheating the oven for athletes to get ready for their training session, for their game, and for any sort of recovery that they have ahead of them. These studies continue to be double-blind, placebo-controlled studies showing the benefits of using phototherapy before, during, and after training. We know that low-level laser therapy can improve performance, power, and strength. Same thing, this is a systematic review and meta-analysis. It showed LED provide no improvements compared to placebo, meaning that LED was used as a placebo, and there's a reason we use LED as a placebo for our double-blind, placebo-controlled studies for Erchonia. Meanwhile, true laser showed improvements in number of reps, less exhaustion, less lactate level production, and increased torque. Once again, objective, powerful, quantifiable evidence discussing the benefits of non-thermal low-level laser. Well, if non-thermal low-level laser acts on a mitochondrial level and it upregulates the production of ATP, of course it's going to reduce fatigue. And this was another phenomenal study. We know that low-level laser can reduce fatigue in competitive cyclists. It can increase time to exhaustion, suggesting this is a possible non-pharmacological ergogenic agent. We saw changes in blood flow, optimized mitochondrial function, decreases in inflammation, upregulated oxygenation, and improvements in cellular healing and recovery. Study after study after study continues to show non-thermal low-level laser can have beneficial impacts on fatigue and recovery. This was a really interesting study to me. This was a systematic review talking about exposing skeletal muscle to low-level laser. Positive impacts show delayed onsets of fatigue, reducing fatigue responses, improving post-exercise recovery, which is a massive benefit for any professional footballer or any sort of physiotherapist or trainer in the clubs. It can also protect cells from exercise-induced damage. And that's where prehabbing with it, using it during the game, and even doing it post-rehabilitation can be very beneficial. And this study administered phototherapy before exercise and resistance training. It's consistently been found to have prophylactic and ergogenic benefits to the skeletal muscle. Well, inherently, in some way, shape, or form, injuries are going to happen, right? So do you think low-level laser has benefits for accelerating healing? Exactly, and of course it does. This study showed that non-thermal low-level laser yields significant improvements in short-term pain management and reductions in pain. We also see lasers having beneficial effects in treating scar tissue. After a surgery, it's inherently inevitable that scar tissue will be forming in some capacity. And all the things that I list on the left are all the negatives that come from having scar tissue. Changes in range of motion, altered muscle strength, postural changes, increases in levels of things like substance P, pain fiber infiltration. These neurons that are trying to fire and wire together, all of this becomes a bit skewed and a bit disconnected based off the notion that scar tissue can get in the way from healing injuries, wounds, and after surgeries. But what's great about it is that this laser is very universal. It's like a Swiss Army knife. These lasers can improve post-operative wound healing and surgical outcomes. And so, yes, you want to have a great surgeon. Yes, you want to have a great rehabilitation protocol after that surgery. But if you could put a little bit more emphasis on recovery and healing and accelerate that healing, would you do it? I'm going to assume most of you would. Wound healing was significantly accelerated in a 74 patient study, 25 to 30% in the group of patients treating with low-level laser compared to the control group. Okay, this is a significant benefit and a significant component for how these things can actually yield fruit and improve the outcomes for not only your physios, but your players, your clubs, and hopefully the entire team. Everyone's in pain, and we know this not only in the football arena, but in general. Global pain statistics are startling. We know that low back pain is one of the leading causes of physical disability. Chronic pain will affect at least 10% of the global population, and it's one of the most common reasons that adults do seek medical care. In the professional football arena, what I would argue is these rates are probably going to be even higher, especially with the wear and tear that comes at playing at an elite level. And what's amazing about this is that Erchonia has 22 FDA approved clearances for low-level laser with low back pain, shoulder pain, neck pain, post-operative surgery. They just got new clearances for plantar fasciitis as well, and nociceptive musculoskeletal pain. These lasers can essentially treat all aspects of pain because they work on a cellular, they work on a structural, and they work on a neurological level. Now, when we're talking about the general population, we know that neck pain and shoulder pain is one of the most widely recognized musculoskeletal disorders. I would argue that's probably going to be even higher once again in professional footballers, taking headers, running into people during corners, playing physical. All of these things are going to add up. And what we know is that studies show that 50% of individuals will experience pain in some way, shape, or form throughout the rest of their life once they start experiencing pain early on. Okay, and what's beautiful about this is that we know that you can utilize non-thermal low-level laser for treating musculoskeletal pain and especially neck pain. Erchonia has a clearance for this, right? This is one of their many clearances for neck and shoulder pain. In their study, in this 8-week study, there was a 45.4% decrease in visual analog pain scores with the use of low-level laser therapy, a near 3-fold improvement compared to the placebo. And once again, guess what the placebo was? Light emitting diodes. Okay, so we were still using a form of photobiomodulation as a placebo, and it showed over time that non-thermal low-level laser continues to be the reigning champion of alleviating pain, upregulating cellular function, and optimizing blood flow. What was interesting about this study that I didn't show you on here is that this study went for 12 weeks, and what they actually found was that 8 weeks of treatment provided beneficial relief, but the patients actually continued to get better and better for the 4 weeks after the intervention was halted. Well, why is that? Because you're changing cellular function, you're changing the brain function and mitochondrial integrity by utilizing these non-thermal low-level laser wavelengths. We also know that there's a potential chance that non-thermal low-level laser could decrease pain medication and opioid use. Study after study after study continues to validate and verify that non-thermal low-level laser is a very viable, very impressive way to decrease pain and inflammation throughout the brain and throughout the body. We know that trauma is going to alter functionality of the autonomic nervous system. The autonomic nervous system impacts every organ and every tissue throughout the body. And it comes back to the original question that I asked. There's parts of your brain that will function and take care of things that you don't have to think about. When was the last time you thought about balancing your blood sugar or getting enough oxygen to your fingertips or toes? Neurologically, your automatic nervous system controls and manages all of these things. And what we know during a traumatic event is that not only can you have changes in structural and neurological integrity, but you have a massive cascade of catecholamines released, inflammatory responses, and dysregulation of the immune system. This whole dysfunction can specifically affect the HPA axis, which is a really integral connection between the gut and the brain and the central nervous system. So let me ask you a question. How does this all play a role in regulating and controlling inflammation? The gut-brain connection is an essential pivotal component of this gut-brain, brain-gut axis, and is intimately tied together with vagal tone and the autonomic nervous system. We know that chronic inflammation can alter the gut, which can also alter the brain. This is the current model of neurodegeneration that we currently understand. We know that traumatic brain injuries and concussions, especially repeated and repetitive concussions and traumatic brain injuries, can increase players' susceptibility to an intestinal permeability, multi-system organ issues, inflammation, and disruption and dysregulation of the immune system. What's interesting about this is that most patients who actually struggle with severe brain injuries don't always die from the injuries. A lot of times they die from the opportunistic infections because of the alterations in their immune system. Now, I want to show you an interesting study. This was a study done in rats back in 2009. It was a study published in the Journal of Neurotrauma. What they did is they induced traumatic brain injuries in rats. And what they did is they did sagittal slices of the intestinal tract of those rats. And what they found was that within 6 hours of a traumatic brain injury, your gut barriers, the gut barriers of your athletes and your patients, go from looking like the top photo, which is a normal GI mucosa, to looking like the bottom. So if you consider your GI or your gut being ground zero for controlling inflammation, immune function, and being able to maintain integrity of your central nervous system, Then looking at the bottom, your castle walls have essentially been penetrated. There goes inflammatory responses. There goes your ability to keep out bugs, viruses, bacteria, lipopolysaccharides that live inside the intestinal tract that can wreak havoc on the immune system and the nervous system when they get into the bloodstream. Your gut and your brain are always talking and influencing each other. And this is why it's so important for us to understand the influences structurally, metabolically, and even neurologically. Because once your gut has become affected, now it's inevitable that most likely the brain could become affected. Okay, the blood-brain barrier is one of the most tightly regulated barriers in your entire nervous system. And there's a reason for that. It's a neuroprotective property of the brain. Those endothelial tight junctions in the gut, the occludin and zonulin gap proteins, are the same occludin and zonulin proteins that keep your blood-brain barrier secure and stable. So when you permeate the gut and you have intestinal permeability, there's probably a very high chance that you're going to continue down that path and have increased blood-brain barrier integrity. And this is where things get really interesting. You all of a sudden turn on your microglia, which are these resident macrophages inside the brain that are continuously looking for ways to find viruses, bugs, bacteria, and get rid of them. Well, now when you have trauma or you have uncontrolled inflammation, these microglia turn on you. These glia become primed. You get this glial priming mechanism where you start promoting things like excessive glutamate, arachidonic acid, which is one of the rate-limiting enzymes for producing inflammation. And once again, you see these pro-inflammatory cytokines, interleukin-1 beta, tumor necrosis factor alpha, and interleukin-6. Everything comes down to free radical generation, and then you can see everything converges on the same thing we started talking about, mitochondrial dysfunction. And now what you have is you have an immunoexcitotoxicity model where the immune system is now attacking healthy tissue is being taken out, and at higher and faster rates, we call this neurodegeneration. And so once the blood barrier has become compromised, the central nervous system and the brain is no longer able to be capable of functioning at the highest level like it used to. Because once again, everything comes back to the brain. If you've ever tried to have a conversation with a cadaver, you're not going to get very far. Even though it's got all the muscles, all the joints, all the tissues, and all the organs. An intact nervous system is what separates us from the rest. And this is why it's some of the most powerful reasons why understanding the brain can help you understand rehabilitation, therapy, and getting your athletes back in order as quickly as possible. We know that low-level laser can have promising benefits in treating the brain and neurodegenerative conditions. There are studies that come out time and time again for treating the brain for cognitive impairments, neurodegenerative conditions, traumatic brain injuries. There are current studies being put on right now by Erchonia where they're looking into treating autism, which have been some really interesting outcomes that they're going to publish very soon. They don't yet have an FDA clearance for that, but the data is convincing, so they're actually doing it again because it looks so good. There's also some studies showing that this can be beneficial for things like Alzheimer's. And what we understand is that transcranial low-level laser therapy has these similar benefits in other tissues as it does in the brain. It can once again dampen inflammation, it can increase the production of ATP, it can upregulate brain-derived neurotrophic factor, which is a trophic factor that can help form synapses and keep synapses stable. It can help optimize cerebral blood flow, and it can stimulate mesenchymal stem cells in the bone marrow that potentially make their way into the cranium. But once again, you can't use level 4 lasers over the brain. Because why? They're high power, they don't have as much energy, the depth of penetration has changed, and they're not there to actually stimulate mitochondrial function. They produce too much heat. And when you have too much heat and you have a photothermal reaction, not the photochemical reaction that lasers get, you won't get the healing benefits that the non-thermal lasers are able to provide the brain and body. Frequency matters. As I talked about, that 635, the 405, those frequencies all matter. And this is a really interesting study kind of validating that. What they did is they essentially used a gamma frequency and stimulated this gamma frequency in the visual cortex of rats. And what they found at that 40 hertz frequency, what it did is it actually decreased the production of tau proteins inside the occipital lobe of mice. And there are a couple of studies validating this now. If you're in the market and startups and looking at medical devices, there are companies out there today trying to replicate and produce these same effects for people with mild cognitive impairment. But why would you wait for that? Why wouldn't you just go and use non-thermal low-level laser for your patients? Because we know this isn't just something that happens with professional footballers or those who are in professional sports. We are in a dire state of global brain health. 55 million people worldwide have dementia. And what's sad about this is these numbers are gradually increasing over time. We know that depression is one of the leading causes of mental disability worldwide, especially in the US. Suicide is one of the leading causes of death for young Caucasian males in this 15 to 29 to 35-year-old ages. Autism and neurodevelopmental disorders are one of the fastest growing neurodevelopmental disabilities worldwide. It grew 119% from 2000 to 2010. And as we continue to look into this, mental health on a global level is just getting worse and worse and worse over time. We know that individuals who struggle with mental health most likely are dealing with some sort of underlying inflammatory response or inflammatory cascade. These same pro-inflammatory cytokines that I just talked about will continue to come up again and again and again. That interleukin-6, tumor necrosis factor alpha, and interleukin-1 beta. Well, what do you think dampens those pro-inflammatory mechanisms? Low-level laser. We know inflammation is the silent killer, but very few providers actually know how to properly address it. And what's interesting about this is that we're finding that SSRIs don't actually just work by upregulating serotonin between the neurological synaptic clefts. The latest theories on why SSRIs work is that they actually dampen inflammation by going after the microglia inside the central nervous system in the brain, dampening their responses and getting them to properly function like the way that they were before the injury. We understand that a lot of this is implicated with various aspects of the brain, but here's what I'm going to tell you, is that there are some specific areas that are pivotal for regulating inflammation. And your vagus nerve and your vagal nerve complex is something that we have to address in order to make sure we understand that. Your vagus nerve is your 10th cranial nerve, and it extends everything from your throat all the way down to your belly button. 80% of this nerve is sensory, meaning that it's giving information about our body, it's giving information about our organs, and 20% of it actually has a motor component to be sent back out to these same organs. But what's interesting about this vagal nerve complex is that it has several anti-inflammatory mechanisms that are responsible for dampening inflammation. And this is why you're seeing vagal nerve stimulation currently being investigated for treating things like rheumatoid arthritis, depression, anxiety, PTSD, cluster headaches and migraines, TBIs, seizures. There are some devices being currently used in the United States Special Ops right now to help armed forces learn multiple language at 2 to 3x faster. There are some devices being used right now to control things like obesity. And so while we don't know the full story, what I'm going to tell you is that there are 3 heavily suggested in research mechanisms that are leading theories that have not been proven yet, but there's a high chance that this is where things are working. So the first one is this anti-inflammatory hypothalamic pituitary adrenal axis, this HPA axis, which release bursts of cortisol. Now, we're not talking about the long-term, sustained cortisol release in chronic stress responses. We're talking about short-term acute bursts of cortisol, much like you would get a cortisol or cortisone shot into your knee to dampen inflammation. These short bursts of cortisol can actually be very beneficial for dampening inflammation. Well, the second pathway is this cholinergic anti-inflammatory pathway, which actually predicates and is utilizing acetylcholine release. These alpha-7 nicotinic acetylcholine receptors on macrophages receive the acetylcholine and inhibit the release of tumor necrosis factor alpha, one of the heavy pro-inflammatory mediators that we've just been discussing. The other mechanism that they're looking at is the splenic sympathetic anti-inflammatory pathway, where the splenic sympathetic nerve actually releases norepinephrine and in a similar fashion binds onto these alpha-7 nicotinic acetylcholine receptors. You're once again having an immune response mediated by the central nervous system. And for those of you who this is new for, I'm excited to get you to understand that there's mechanisms out there. For those of you who've heard this before, well, you're probably not surprised by that. But here's how, traditionally speaking, most people go about stimulating the vagus nerve. Now, this is where it used to be. We've made a lot of progress in the last 10, 15 years since then. But this is what it looks like to actually install and implement a vagal nerve stimulator implant. What they're doing is they actually found a strand of the vagus nerve wrapped around the carotid artery on the left side of the neck. On the left side of the neck where you can find your pulse, The vagus nerve wraps around the carotid artery, and that's where they're trying to find access to the vagus nerve. So what they do is they essentially go in and put in a cardiac pacemaker style med device to stimulate the vagus nerve in order to optimize and upregulate vagal nerve tone. But if you're not signing up for that study or that procedure anytime soon, which I'm not going to be, then why not utilize low-level laser? Erchonia did a phenomenal study about this. They utilized non-thermal low-level laser over the same location you just saw that surgery being performed in. And what they found is that the combination of red and violet light, they weren't using green laser at the time, they found beneficial effects in conditions and potentially propagating and improving conditions like depression, neurorehabilitation, dementia, and autism due to the coupling of increased blood flow and increased EEG signaling. And this is what it looks like. All of these results are pre and post low-level laser vagal stimulation. Once again, where we're not touching the patient and we're not asking them to do any other form of therapy whatsoever. And while the research is convincing, I want us to remember that regardless of what you are doing with your patients, regardless if you're in a professional football club, if you're a physio, if you're modifying or regulating patients in the clinic or the office, you are modifying and upregulating and influencing your patient's brain, because every single provider on this call is receptor based. And I don't care if you're an MD, you're a nurse practitioner, naturopath, DO, DC, DPT, it doesn't matter to me. Every single one of us will rely on some sort of intervention that can either upregulate the brain, the body, and central circuits. And it doesn't matter how you do it, whether it's with medications, rehab, therapy, low-level laser, lights and sounds, all of these things are going to influence the brain in some way, shape, or form. So when you ask, why would I utilize non-thermal low-level laser therapy in my office? I hope you can go back to the slide. It's for all of the reasons that we just talked about. And once again, all of these things converge on upregulating mitochondrial function, decreasing inflammation, accelerating cellular healing, and improving and increasing the efficiency of the electron transport chain to produce ATP for cellular regeneration and healing. So with that being said, I assume that there are probably going to be questions. If not, that's completely fine. If you have more questions or you want to reach out and you want to get more information about Erchonia, the company, you want to see some of the research and the studies that I mentioned, scan this QR code or reach out to Simon Ramshaw. Simon will take care of you. Simon will get your questions answered, and he'll make sure that he has enough follow-up for you to make sure that you can make a decision as to where you would like to go next. If you have questions for me, I'm more than happy to answer them. Here's my email address if you want to take a screenshot of that. I'm happy to field any additional questions that people may have. And so without further ado, Simon, I know that you're on the other side as well. So if there are any questions, I'm happy to field those now in the moment.
Hi, Dr. Erik. As usual, very insightful. And it's something that we're investing a lot on this side of the pond. And I hate to say it, but you guys are so much more advanced across there with regard to this sort of thing and knowing the differences with different types of technology. And I put that a lot down to, you know, the likes of the FDA that you have in the US. Now things are changing in Europe now with medical device regulations. But beforehand, as you probably, if you can remember, to get something into Europe, you just had to prove something was safe. So we get flooded with so many different technologies making all sorts of different claims, but they didn't really have anything to back up the efficacy of them, which obviously, as you can imagine, has upset a lot of practitioners and doctors in the same position as you. Whereas with the FDA, for the level 1 research, they actually give you result criteria that you must achieve. Otherwise, they won't clear you. And as we know, they're randomized, they're double blind, using LED, as you alluded to quite a few times, as a sham, and multi-center. So that's something we as a company put a lot of credence on. Now, there's quite a few people who are on this, Erik, who have sent me private messages on our WhatsApp group that we have. How do non-thermal lasers influence nerve function and muscle recovery in high-performance athletes? Now, I think you've sort of covered that, but do you want to just re-elaborate over it again, please?
Well, I think one of the main mechanisms for why this works so well is you're just upregulating every cell's basic needs, which is to produce ATP to increase any cellular mechanism. whether that's recovery and healing, whether that's a sprain strain, whether that's a muscle injury. Every single one of those aspects requires energy from a cellular perspective to do. So when you increase the availability and the resources necessary for that, you're inherently going to see improvements in all of those aspects. That's why low-level laser is so interesting to me, is that it affects so many tissues and so many organs in so many ways, because they all require this one fundamental thing, which is the production of ATP, to use that as a fuel source for recovery. So it's a fundamental aspect that every cell in your body has mitochondria. Red blood cells do, white blood cells do. Like I said, there's a high density in the brain and muscles and joints. So it just makes sense why every single cell could benefit from this sort of therapy.
No, I agree completely. And, I think as we're all born as human beings, we have everything that we need to live a normal, healthy life. But unfortunately, as time goes on, whether it's bad lifestyle, bad diet, all of the things that they put in foods, alcohol and all sorts of things, our cells don't function how they should, and our mitochondria doesn't. So, we need inspiration, and that's what we're trying to provide. Okay, I know this question, it differs from person to person, but what kind of protocols or treatment regimens do you recommend for athletes using this technology?
Well, it depends, right? So it depends on the patient, but what I'll tell you is that what's great about Erchonia's company, about their products, is that it's just gonna be hard for you to overdo that, right? With the pulsing of the laser, with the wavelengths that you have, a lot of the magic is in the wavelengths, and some of the additional benefits can be in the pulsing. There's different protocols, there's different aspects to go into, but essentially the best part about that is that you don't need to know any of those. As long as you have the proper wavelengths and you have a product that is FDA cleared, then all you need to do is point and shoot, right? So I don't get too caught up in the pulses and the hertz frequencies, although I do use a lot of those based off of neuroscience and a lot of the research papers that I've looked into. So there are different protocols out there, but the best part about that is there's such a high chance of you helping somebody by just using the device that those protocols probably don't matter as much as you just getting your hands on and getting those patients in front of the laser.
No, I agree completely. I mean, the research that we've done, or that Erchonia have done, should I say, was twice a week for 3 weeks. So that's the general rule of thumb. But we try to make it as easy as we can for Europeans, because this is relatively new technology to them compared to the US. So we have a point and shoot process of how you integrate it in with range of motion, passive and active, and the same with resistance as well. So it's try to break down the process on how you integrate it in with the manual skill set, and that seems to work pretty well, across here. Now, when it comes to protocol, I use it every day, but because I've got a laser, so if I want to treat myself from a wellness performance perspective, I want to treat my vagus nerves, I can do my brain health every day, like that day. I can do my vagus nerves, but obviously sports clubs, maybe 5 times a week, it's possible to get that energy in there to the players.
I would agree. I have patients that I see every day for stints, and I use the laser for 5-10 minutes a day on them at least. And so I have patients that rent our lasers out, and I tell them, you can use this 2 or 3 or 4 times a day, depending on the condition that they're dealing with. And so daily isn't an issue. Even like bi-weekly isn't an issue either. It's all about the patient, and it's all about the frequency that you utilize it for. And so there's no template right or wrong capacity with that. I think it's really just based off of the player and the athlete's needs.
Definitely. I can run through this one. To be fair, are there any restrictions or contraindications for using non-thermal high energy lasers in sports medicine? Now, the studies that Erchonia put out there isn't a contraindication as such. There was exclusion criteria in the research. For example, top of the list is always pregnant women, because nobody's ever conducted any research on pregnant women, and so that's always a no-go area on pretty much every technology. Another one was breastfeeding, another one was active cancer, another one was photosensitive epilepsy, for obvious reasons when you're actually shining a light. But beyond that, Erik, I don't know within your practice whether you add anything else to it, because we know it's reduced. We know it's not going to do any damage because there's not been any adverse reactions or side effects. So a lot of it, we say as well, it's down to the knowledge of the practitioner who's doing the treatment.
Correct. And then, Erchonia doesn't have any FDA clearances for using it over the head or the cerebellum or the frontal lobe, but I do it all the time. And I look at pre and post testing. I'm looking at autonomic function. I'm even applying it in the nose of patients because there's antiviral, antifungal, antibacterial benefits as well. So I'm trying to do everything I can to upregulate brain function and cellular functionality with that. So I use it off-label with my patients, and I've had some phenomenal results with it. I have patients that swear by it and only come in for it now. So you know, there's reasons for why I do what I do with that.
That's one of the biggest frustrations we have as a company. I've seen so many examples of, you know, really dynamic situations where we've reduced pain, accelerated the whole healing process. But as a US-based company, you know, we can only really promote, you know, what we have the FDA clearances.
Yeah.
But as yourself, as a doctor practitioner, obviously you can give guidance on everything that you do within your clinic and what sort of responses you've seen.
Yep. Yeah, fair.
I absolutely love this question. Somebody's had their thinking cap on tonight. And I'm thinking here they probably get where you're coming from with regard to how it works by way of energy, but they're saying, you know, where do you see this technology evolving to?
Well, here's where I see it evolving. Yeah, I see it evolving as it's going to become a standard of care, right? So there was already a lot of research even during COVID with the 405 nanometer about the antiviral, antifungal, antibacterial properties of it. People were using it clinically, they were using it for sterilization. They're using wavelengths already as a way to upregulate and optimize cellular healing and functionality structurally, neurologically, and metabolically. So you're going to see this become a common thing. The biggest thing that you're going to have to realize and recognize is that there are companies out there who are going to be putting out phenomenal products. And then there is going to be everybody else who's going to put something out there saying, oh, we're equivalent, or oh, we're better because of X, Y, and Z. And so there's a lot of marketing gimmicks and tactics out there. Look for companies that have FDA clearances. Look for companies that do double-blind, placebo-controlled studies. Look for the ones that put their reputations on the line because they're the ones that you're going to want to follow. Otherwise, you could be hurting and damaging your patients. When you get into these high power lasers, they talk about how much power they have or how much more power they provide in their depth of penetration. And they're correct on that. The problem is that's not necessarily a good thing because if you're heating up tissue, you may be damaging the tissue instead of actually providing the healing properties that we're talking about with non-thermal high energy laser.
Yeah, we see that more, especially in the aesthetic marketplace, because we have an FDA cleared laser which reduces fat, and it's the only one cleared for obese patients. But we see it all the time by way of a lot of companies who bring something to market and they brag or they promote the power, the depth of penetration that you're actually delivering. And it sounds good, but you know, a good analogy was one that was used by the president of Erchonia, Steve Shanks, where he referenced a study that was done on the retina. And I think it was something like 6,000 photons were delivered into the retina. And it looked at how many of those photons could be absorbed to create a photochemical response. And there was only 700. Actually, it wasn't even to create a photochemical response. It was just to create a response. And there was only 700 out of those 6,000 that were absorbed. So increasing the power to increase the depth, it's sort of like, you know, having an already full glass or bottle of water and trying to put more in. You can't put more in, and it's disgraceful that some companies will, you know, go that low to try to, you know, promote that the efficacy of their equipment, where it sounds good, but the situation is it absolutely makes zero difference.
Yeah, yep, I agree wholeheartedly. So
okay, I'm conscious of people's time as well. There's a couple more questions coming. One is, which I know actually about this, infrared-based devices are widely used in Europe for pain relief and rehab. What key differences set these lasers apart? Now, I can elaborate on that, but if you want to go first, Erik, with that.
Yeah, and so I just have a cutoff to get to, but in infrared, when you think of infrared, you're essentially looking at the higher wavelengths, so 7, 8, 9, even to 1,000 nanometers. And what the mechanism of action is you're oscillating and vibrating water molecules to produce heat. Infrared has a photothermal response. The laser has a photochemical response. You're not actually going to get the benefits of increased ATP production as a result of a photochemical or photothermal response. You only get that from a photochemical response. And so if you're heating things up, fine, heat lamps, tissue, yeah, you're going to bring more blood flow to the area, but you also might heat the tissue up too much. that's the risk that you run, and that's the issue that comes in with that.
Yeah, and that's very much part of the education. We like to try to deliver a lot of neutral education, because if I'm a doctor or a practitioner like you and a lot of the people on this call, I think my patients deserve me to know, or deserve to know, everything that you have, the knowledge of everything that's actually on the market. Whether you decide to purchase it, it's completely up to you, but at least, you know, have the knowledge, the factual knowledge of what the differences are between each thing. And we frequently get it because infrared and non-thermal high energy laser fit under the low level laser umbrella, but they're like day and night when it comes to how they actually work with, as you said, even though infrared's mild heat, it's still photothermal, you know, where non-thermal laser diodes photochemical. So the mechanism of action is like day and night with regard to how it works. So if we want to make these cellular changes, we want to give the body everything that it specifically needs to operate properly. And the mechanism there is, we're not saying that it won't work on certain indications. Of course it will, but it's sort of delivering heat, which will give you sort of a mild relief to a specific issue. But our thing is, well, let's try to find out where that issue is coming from in the first place, from a cellular level. Is it coming from the area that you feel pain? Is it actually linked to the nerve root? When we're saying point and shoot there, frequently, if we're treating tennis elbow or neck and shoulder pain, we'd also treat the cervical part of the nerve root as well, to try to get the systemic communication going between the two. And that's just one example of many differences. But yeah, like you said before, Erik, I think it's very much a case of just try to understand it. Whether you think it's for your practice is immaterial to an extent. Just, you know, make sure that you're aware and you're properly educated with anything that you go for.
Agreed. Yeah. Lovely.
On that note, I think that's pretty much it. No, there's nothing else that's come in there. Listen, Erik, I know you've got patients to go and see, so just from the bottom of my heart, thank you for coming on and sharing the knowledge and sharing your education. And hopefully people will be able to take something away from this. Now, everybody who's come on will be sent an email after thanking you for attending, but also sending a recording through of this presentation. So please, if you have any questions, I know Dr. Erik had a QR code up there before, but you will receive an email anyway if you didn't have a chance to screenshot it. So please let us know if you have any questions about anything to do with laser, and we'll be more than happy to share it. So on that note, off you go to the cold Minnesota weather. I'm sure is it reached 0 Celsius yet, or is it still
45 degrees Fahrenheit today? So we're above freezing, and we're happy about that.
Yeah, you're broaching on spring now, aren't you? So yeah. Erik, thanks very much again. It's a pleasure. Everybody out there, thank you very much for attending. And yeah, we hope another one of these in a few weeks' time, showing the practical element of demonstrating, you know, the different types of treatment when it comes to sport medicine and how it would integrate into what you already do. So please keep an eye out for that invite. Thanks again, guys. Yeah, thanks. Bye-bye.